Hello, I'm Jennifer Sagers, Physician Assistant or PA at the Community Health Clinic. Today we're going to talk about MCADD. MCADD is a medical condition called an inborn error of metabolism. Inborn errors of metabolism are medical conditions people are born with that affect the way the body breaks down food and creates energy. There are many types of inborn errors of metabolism, including fatty acid oxidation disorders, which are problems the way the body breaks down fat for energy. MCADD is one of several fatty acid oxidation disorders. Fatty acid oxidation disorders are rare inherited disorders where people lack a specific properly working enzyme that helps break down fat from food from the body into energy the body needs. People with MCADD lack an enzyme called medium-chain acyl-CoA dehydrogenase and cannot break down certain types of fats. This leads to decreased energy for the body, which can cause health problems. In the U.S., about 1 out of every 17,000 babies is born with MCADD. Babies with MCADD usually appear healthy at birth, but if undiagnosed and untreated, develop complications during infancy and early childhood. In a minority of cases, the symptoms do not appear until later in childhood or adulthood in someone with MCADD who is not yet diagnosed. Symptoms include periods of acute metabolic crisis where a child develops lethargy, which is extreme sleepiness or fatigue, hypoglycemia, which is low blood sugar, and or vomiting after a common illness or fasting. Seizures and liver enlargement or problems may occur. Crises can progress quickly to coma and death if not treated properly. Children may be at risk for losing developmental milestones or other developmental problems if brain damage occurs during a crisis. There may be long-term muscle weakness, fatigue, and inability to perform physical exercise in people with MCADD. Treatment for MCADD involves avoiding fasting and proper care during illness and stress to ensure that the body has enough energy. The recommended diet usually includes carbohydrates and a low-fat diet, avoiding medium-chain fats. In a crisis, patients are treated with carbohydrates or a form of glucose by IV. Monitoring for and avoiding hypoglycemia is important. Foods to avoid or limit include high-fat or fried foods and foods that contain medium-chain fats, such as coconut oil, palm or palm kernel oil, avocado oil, and coconut milk. During pregnancy, women with MCADD should take extra care and see a knowledgeable provider to ensure their health. Parents need to keep a home monitoring kit for times of illness. This would include a glucometer to check blood sugars, a source of glucose or sugar that can be absorbed quickly, such as glucose gel, a working thermometer, and acetaminophen or ibuprofen depending on the child's age. Parents who have a child with MCADD keep an emergency protocol with them to share with emergency department staff if their child were to become ill. It's important to educate the child on their condition as they get older so they know what to do to stay healthy. One way to do this is to read them books like Max the Monkey Has MCADD, or having their teacher read the book to the child's class. Eating a low-fat diet, along with many fruits and vegetables, drinking fluids high in calories during periods of physical activity or illness, and avoiding illness can help keep a child healthy with MCADD. Thank you for listening and supporting our clinic so we can continue to take care of families who have rare conditions like MCADD.